Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. With me Skyping in, as now is a regular daily event and on into the future, is former director of the Rhode Island Health Department, Dr. Michael Fine. Dr. Fine, thanks for Skyping in today.
Great to be with you, Josh.
Okay, we come off a lot of news. We were on yesterday, but even just since yesterday, a tremendous amount of developments in the government, both at the federal level and at the state level, in battling the coronavirus. Let's start with the numbers.
Sure. The numbers are as follows: 174,893 cases worldwide, about 6,700 deaths. And here's an important number that we haven't started talking about, but I want to mention and come back to, that there have been 77,657 people who have had this disease and recovered.
Right.
And so the number of people who we know as recovered is significant, and we want to remember that most people who get this disease recover. And these are just measures of people who have been tested. We don't know anything about the numbers of people who have had mild disease and were never tested. Now, in the United States, we're up to 3,813 cases, unfortunately 42 deaths. In Rhode Island, we went up one, we went from 20 to 21 cases. There have been 271 negative tests so far, and 117 tests pending, with 2,300 people in self-quarantine. I am much encouraged by the slow growth in the positives. That doesn't mean that we're out of the woods by any means. This is just the beginning of this, but it means that the governor and the Department of Health and the population as a whole is doing a fantastic job doing what we've been suggesting people do, which is quiet everything down and stay as close to home as possible.
I'm going to amend one of your numbers. I believe the national death toll is now at 62, not 42. I do want to point out something that you said offline, picking up a key element of the governor's and Dr. Alexander Scott's press conference this morning. You mentioned that she said a very, very key statement. Do you want to go into that now?
Well, I actually think there were two key statements. The first is Dr. Alexander Scott mention of community spread or community dissemination of disease. That means that there's at least one person who we can't find the source for, which means there is some disease that is in the community, spreading in the community, that we aren't seeing and may be infecting our most vulnerable people. So that suggests that though the number of cases we have is 21, the number of people infected may be many times that, maybe 100 or even 200 times that. And that's what we were expecting. That's not a surprise. The Department of Health has done an exquisite job keeping the numbers so low for so long, but we can, I think, expect those numbers to gradually, perhaps even quickly, increase. I expect the number of cases to double about every 5 days. Anything less than that is fantastic. But remember also the number of cases that we see are a function of how many tests we've done. And if we've done, pretty close to 400 tests, we're adding the capacity to test 100 or 200 people more a day. As we add testing, we expect to see more cases as well.
I believe the capacity now in Rhode Island is 200 a day, and in Massachusetts it's up to 400 a day.
And I think the number of testing sites will climb quickly by the end of the week. So I'm hoping that as soon as we can, we get plenty more tests available and plenty more testing done, remembering that a positive test doesn't really help the health of a person. A positive test helps us protect their families, and a positive test tells us how much disease is out there and where that disease is.
You said there were two key insights that she made this morning. One is community spread, and the other?
The other was, we haven't yet mentioned that restaurants are now closed for people to come and sit there. People have wondered how long this thing's going to be around. And I think I've said before, but we'll say again, I expect it to be around for at least 3 months. And kudos to the governor for recognizing it and laying out what the future looks like.
Let's jump over to what the federal government's done. The CDC issued regulations yesterday, or advisory, that there should not be public gatherings of more than 25 people. What does that tell you, not only that factoid of an advisory to the country, but what does that tell you about their level of worry about where we are in combating the spread of the coronavirus?
Well, I think they've now recognized that there's community spread in a number of states. I don't know if we're up to all 50 states involved yet, but we're pretty close if we're not there. They've got to be really cognizant of what's coming at us and trying to manage the number of cases and manage them as well as we can so that we can reduce the rate of rise of new cases, which is what we need to do to keep the number of cases we have manageable by our hospitals and urgent care centers and other health facilities.
Where do you see the Vice President was supposed to have a big press conference this morning with a number of national steps. That's gotten delayed till 3:30 in this afternoon. Do you foresee us looking at a, quote, lockdown, something like Spain or Italy, in which really, unless you are going to the grocery store, unless you are going to the pharmacy, you are to stay really inside?
I don't see how we avoid it. I think that's the only way we're going to reduce the rate of rise. I don't see much travel, I don't see much movement, and I don't see much economic activity in the United States for the next 2 to 3 months at least.
And how does the healthcare system respond? You've gotten guidance from the Department of Health of how physicians are to behave, get ready. There's certainly just not going to be enough physicians and frontline nurses to be able to take this on. What's your thoughts of how best Rhode Island's healthcare system can be ready to take on what is potentially an onslaught?
Well, I think I've said before that I'm hoping the governor would use her executive authority to put all healthcare providers under one roof so we have command and control and can distribute the work intelligently. From the perspective of community health centers and small practices, the work is going to change radically. We are moving quickly to doing as much as we can by telephone because that's a really important assist to this whole process. We have to learn very quickly how to manage, how to do infection control in our practices in a way we've never had to do before. My guess is that we will see our workloads go up and down. We're on the one hand encouraging people who are not ill to stay home unless they really need to be seen. And we're seeing, in fact, the drop-off of some of that workload day to day, at least in the short run. But we don't know what's going to happen as time goes by. We're going to have to segregate people who have fevers and coughs from anyone else who comes in to be seen to try to protect our staff and anyone else who needs to be seen. We're learning to use protective equipment in ways that we haven't before and are struggling to get those supplies so we can take care of people responsibly. We're going to have to build, I think, isolation hospitals or units, and some of us may need to go and staff those. There are just a myriad of changes. The challenge is to, in a nation that's had a market instead of a healthcare system, to put together a healthcare system very quickly, perhaps within a week or two, and get that healthcare system focused on a couple of key objectives.
Let's talk a little bit about our physicians ready. There's significant equipment that needs to be used for their own safety. Is the equipment there, the masks, the other protective materials, and do they know how to use it?
It's on its way. People have some knowledge of how to use it from Ebola, but people are having to relearn, rediscover, remember what the rules are and what the approaches are. That's an important piece. And then remember, another important piece is finding ways of directing people who might be sick with this disease to places where there is adequate personal protective equipment, so that healthcare workers are not placed at risk.
What's going to happen to the healthcare industry in Rhode Island from an economic standpoint? There's going to be tremendous demand on them, the busiest time of all. Will they be able to recapture the revenue from doing elective surgery, or is this going to further exacerbate some of the financial problems that we see in the system now? Lifespan having significant economic issues, Care New England having significant economic issues.
I think it's going to make a mess, and some of this is unpredictable. In the short term, there are going to be big cash flow issues, I would expect, unless government steps up and starts providing cash assistance to all healthcare providers using a calculus that we haven't derived yet. And hospitals, I don't know what's going to happen in terms of their business. As you say, elective surgery is going to go away for a while. Ambulatory surgery is going to go away for a while. And, I think healthcare organizations and institutions are in that way going to be kind of like everybody else. We are, on uncharted territory economically. And everybody together has to figure out how to survive. Essentially, this is where government, which is, sometimes criticized by some, this is where government is going to be critical to step up and figure out how to provide this and sustain us until we get to a recovery.
What should people know for the short term? Is there enough urgency in parents getting their kids in their houses? We live across from the Brown University fields. It seems like there are kids out there playing together over the past few days, almost 24/7. Is the parenting responsibility need to step up in this period of time?
Sure, though, we all know that parenting of adolescents is always a challenge. This is the time for people to be clear and strong and be the bad guy, which is not necessarily a popular perspective among parents, but this is the time for people to lay down the law, for better or for worse. There just kind of is no alternative. But just let me mention that this is also the time for every parent to make sure they have a thermometer and make sure they know how to use it. Believe it or not everybody does. Not everybody knows how to use it. But this is the time to have it, to test it, to know where the cover is, to know how to make it work, so that should somebody get a fever, you can measure it and call and report that to your health care, to your primary care clinician.
Last word, the governor's coming back at 4 o'clock. I'm expecting that she has real news at 4 o'clock as well, and did not want to overwhelm sort of Rhode Islanders with closing the restaurants for a period of time and then coming back and hitting them with a double whammy at the same press conference. So she's going to come back at 4 o'clock. What is it that I think would set you off as being the biggest worry number that if she were to announce? What's that we're really not in control or have a strong enough strategy to manage this?
Well, I think it's going to be a number of new cases. It's the number of new cases is an immediate feedback on how we're doing, but you got to temper that with the understanding that we are radically increasing the number of people we're testing. And we'll see. I think we've done amazingly well so far. That doesn't mean that we don't have big challenges ahead. So I'm hoping that she'll come back with relatively few new cases, and I'm hoping she'll come back with strong words about the reorganization of the healthcare system, with a real plan, in the next few days, laying out how we get command and control over this, sort of diffuse and disconnected set of providers who are in the market to sell services, but don't have necessarily the responsibility to protect the public's health correctly until now.
Dr. Michael Fine, I want to thank you for joining us again today. We'll stay in touch with you and your expertise over the next 24 hours. Thanks everybody for tuning in. Let me just recap. This morning the governor had a press conference announcing that in-restaurant dining is suspended. Then Vice President Mike Pence was supposed to have a press conference 10:30 this morning. That's been pushed to 3:30 presently. Dr. Fine is here, and then the governor will be back in a live news conference on GoLocal Live at 4 p.m. today. Thanks everybody for tuning in. We'll try our very best to keep this coverage up as this story develops here in Rhode Island and across the country. Thanks so much.
Thanks, Judge.